Modern vein treatments are performed under local anaesthesia as a walk-in, walk-out procedure, so there is very little restriction on what you can do afterwards. I'm going to tell you what advice I give to my patients after varicose vein treatment. Immediately afterwards, you can walk around normally. On the day of the procedure, I recommend that you sit with your feet up. Keep the blood flowing by performing regular ankle movements, the sort you might do on a long-haul flight, for example, and get up regularly for a walk. The day after your procedure, you can do everything normally. Walk as much as possible. Walking encourages the healing process and promotes the vein circulation in the legs. You really can't do too much walking in the first week or two. After your procedure, you will go home wearing a medical stocking with absorbent wool underneath. I also place a bandage over the stocking on the outside. I advise that you keep the bandage and stocking in place for 48 hours. However, if at any time the bandage feels tight, you can take it off immediately. After taking the bandage off, if you still feel uncomfortable, or if your foot swells, or if you have tingling in your toes, after the local anaesthetic wears off, remove the stocking completely. After 48 hours, you may remove the bandage, stocking and wool completely if you haven't already done so. You will usually have some sticky plasters over any needle pricks. I suggest that you leave these in place, have a shower, and then after your shower, peel these sticky plasters off and replace them with new ones. Many people find it comfortable to wear the surgical stocking either day and night or just in the daytime for another week or two. However, if you feel more comfortable without the stocking, leave it off. At any time after the first 2 days, you can have a shower without your stocking on. Most people have very little discomfort, but if you do need pain relief, paracetamol or ibuprofen are usually sufficient. From a medical point of view, you can drive when you feel able to perform an emergency stop, usually the day after your treatment. Some people need a bit longer before they feel confident to drive. Do check with your motor insurance company and don't drive if you feel uncomfortable. You can resume exercise, going to the gym and sports when your legs feel comfortable. I generally advise avoiding contact sports where your leg is likely to be knocked for about 14 days. There are often harsh chemicals in swimming pools, so it may be a wise precaution to avoid swimming for 14 days as well. Many people ask me about flying after their vein treatment. I guess the concern here is deep vein thrombosis. Fortunately, complications such as DVT after modern vein treatments such as endovenous laser are very rare. However, long-haul flights are a known risk factor, and I think it is a wise precaution to avoid taking a long-haul flight for 6 weeks afterwards. There isn't any strong evidence in the medical literature to back up this recommendation, but in my mind it is better to be on the safe side. Let me say that these are my own general opinions. Your particular circumstances may need additional advice. For all my patients, I may modify my advice in the light of their medical condition, and if you have had treatment by another specialist, then you should follow the advice and recommendations that he or she gives. Now, I hope you found this interesting. Do please subscribe, and that way you will be among the first to see my next video. Thank you for watching.